Good morning, everyone, and thank you for joining us. We'll just give it 1 or 2 more minutes. There's still some attendees joining the webinar. All right, I think we're probably good to get started. So again, good morning, everyone, and thank you so much for joining us today for Hydraight's Investor Webinar. My name is Julia Becker. Most of you know me, but I am the VP of Corporate Communications with Hydreight, and I will be moderating this presentation and Q&A. Joining me today is founder and CEO Shane Madden, as well as Vahid Shababi. Shane and Vahid will be discussing the recent partnership announcement with Ola Digital Health. There will be an opportunity for questions following the discussion. If you would like to ask a question, there's a Q&A box at the bottom of the screen. Please submit the questions through there, and we will try and get through them following the discussion and presentation. Just a friendly reminder that this presentation may contain forward-looking statements which involve inherent risks and uncertainties and other factors that could cause actual results to differ materially from management's current expectations. Investors are cautioned not to place undue reliance on such forward-looking statements or information, and that such information is considered reasonably based on the information available to management as of today. So with that, we will get started. I'm going to pass the presentation over to Vahid. Vahid, the floor is yours.
Thank you, Julia, and thanks everyone for attending the webinar. We have one announcement yesterday regarding this partnership and would like to add more color to that for our investors and other people out there who's watching Hydreight's story, and also answer all the questions. So I'll start with a background on Ola Digital. Ola Digital is the digital arm is the digital arm of a large pharmacy group, which directly has access to 300 locations and indirectly has access to over 1,000 locations over 49 states. So this group is in charge of bringing the innovation, working with them directly, and implementing different innovative technical and IT solutions for them. Now, this has come a long way by the time that we announced this one, that the management team have been working on this for such a long time. I'll give you a quick background on the industry. If you look at the larger players in the market in the United States, such as CVS, Walgreens, and all the other larger franchises, they've all have been trying to get into providing services, at-home services, or even have at-location services to be done by healthcare professionals. They all have different pages on their websites and their announcement that have been trying to do this, and they started it. Some have stopped, paused, and some is still working on that. The biggest challenge that comes for pharmacies is that they don't have the proper infrastructure to provide the healthcare professionals full compliance to offer their services. Infrastructure such as a friendly PC licenses over 50 states, such as having a medical director, having access to a doctor network based on the proper licenses across the United States to be able to providing this, and more importantly, a technology that can define the flow of the service, both for patients and healthcare professionals. After the COVID, the whole industry has shifted toward at-home services and providing the healthcare professionals the ability to start offering those. However, the infrastructure is not something easy to get, and that's the advantage of the Hydreight. That's one of the reasons that they're looking at Hydreight as Uber in the healthcare industry, not because that we're offering services at home, but because we're the platform that is essential for any healthcare professionals to be able to work, to start offering their services at their location and become a 1099 contractors and be fully independent in offering their services. So the industry is moving that way, but they don't have the infrastructure. They don't have access to the nurses who are the most qualified group of people in the healthcare professionals that they can start offering services at locations or at home. So with that vision, we started working with this large group of pharmacies to come up with the solution that not only we can make it easier for patients, but also make it easy for these pharmacies to start offering their services. Now, the name of the pharmacies will be announced separately because they want to make an announcement together with us after we figure out all the details of the flow. We'll talk about this shortly. We're gonna launch this with 7 locations, and Shane is gonna talk more about the details for us, how we're gonna launch this, and the flow and all that. And after that, we're gonna have an announcement to introduce the chain of the pharmacies that are on board with us to do that. Now, with having the vision of this partnership and what Hydreight is providing in that partnership, I'd like to pass it to Shane to walk you through the flow of the service, how the service works in details, the benefits for the Hydreight, and the bigger vision of this level of partnership that we created that is going to open a new door for us to work with any pharmacy in the United States. Shane, please take over.
Thank you, Vahid, and hello, everybody. Thank you very much for joining. Very excited to share the message here for many reasons, but this is the furthering of the vision of Hydreight, as Vahid kind of alluded to. So I think I'd like to go over kind of the reason that this was possible, and then I'll go into kind of how it operates itself. But as Vahid very eloquently put, a lot of the bricks and mortars, pharmacies, and other businesses are trying to get into the health and wellness space. Utilizing the Hydreight network as a turnkey way to do that is what this announcement is about. So there is many reasons that a pharmacy trying to get into the health and wellness service offering side of things would be a tremendous task. Not only the compliance side of it from either corporate practice of medicine with our PC structure, but our medical direction side across all 50 states, our access to physicians across all 50 states for telemedicine, the technology that is needed from an EMR perspective and just a simple booking perspective, access to pharmacy products that are specific to the services, and all of the above. So when I say I'm excited about the furthering of the Hydreight vision, Hydraight's vision was to be a mobile medical, all 50 states nationwide, mobile medical clinic. So this is an expansion of that idea. So what made us so attractive to Ola and will make us, so much more attractive to other offerings is the turnkey element. So we bring the operational side to an endeavor that otherwise would have been essentially either really difficult or take a long time to offer. So how it's going to work is Ola obviously has a network of pharmacies, as Vahid alluded to, across all 50 states. We're going to start with a pilot program. What we're going to do is we are actually going to create a specific menu with our doctor of pharmacy for 7 locations in Florida. So we're going to start off in one state, get the flows down. We are going to surround those locations either with Hydreight nurses, or Ola are going to bring nurses from their network to Hydreight. Everything is going to be booked on the Hydreight app. Everything is going to be ordered through our digital pharmacy. Our doctor network physicians are going to be utilized to handle the telemedicine calls. And essentially our Hydreight network is the operating arm of these locations. So these locations are trying to get into the health and wellness space, offering these services. Hydreight is going to be the operating arm. From a marketing perspective, we obviously have many tools on our Hydreight platform to integrate with a facility. So the facilities will be bookable on the Hydreight app. From a corporate perspective, Ola, and from an individual pharmacy perspective, they will be marketing these services to their clients, which will be driving users to the Hydreight app to book. We'll be utilizing our service provider network to provide the services at the location, which again is a huge benefit to the pharmacies themselves. Very little footprint. We provide widgets, QR codes for marketing, all of these things. So we can integrate seamlessly with what they do now, integrate with their website. Marketing materials can be utilized via QR or other means to download the app. And to have a seamless booking experience. We also have widgets outside of the app, which is a web-based booking flow. So we have all of these tools to allow the facilities themselves to market these services at their facility with very little footprint, technology-wise. The upside for both entities, Hydreight and Ola, is obvious. They are going to be able to expand into other services, other offerings for their customers. Hydreight is going to be able to expand its users via the marketing efforts as we expand nationwide. Some of the indirect is for locations as we go from 7 in Florida to 10 states to 50 states to 300 to 500 as we had recognized. We will not have a current business partner in some of those locations. So Ola and their nurse network, service provider network, will be providing nurses to the Hydreight platform to service those locations. So kind of a hybrid model of expanding the Hydreight network. So those are some of the high level reasons that this is such a great opportunity for both sides, and reasons and operational endeavors that we're going to be working on. From a business model perspective, it works just like Hydreight does now, except we are servicing the needs of a bricks and mortar chain that is looking to get into this space. There is some indirect things that we will be announcing down the road regarding the pharmacy side of things that will be of a tremendous benefit to Hydreight. Through this endeavor, again, I can't speak too much. We will be announcing these later. We are going to work on creating specific lines for the Hydreight platform, which will have a tremendous effect on our pharmacy profit margins. And again, there'll be more to come on those things. So from a high level perspective, it's a very exciting endeavor. As I said, it's a furthering of the vision of Hydreight, and there's tremendous benefits here to both sides, and both sides are very committed to making this a tremendous success.
So with no further ado, we can go to the Q&As. We already have a few questions. And if there's any question regarding this initiatives, please feel free to add them to the Q&A, and Julia can ask those questions.
Perfect. And thanks so much for the clarity and discussion on the partnership. The first question that came in, and I think, you know, we said in the press release, with Ola currently having a network of 300 pharmacies, what is the plan to expand to kind of that 1,000 number that they've alluded to?
So just to clarify on that, the Ola has already have access to 1,000+ pharmacies through their network, right? The first phase that is going to be through a network that they have 300 locations. That's one of the chains that they work with, but they already have access to 1,000+ pharmacies in the United States that they're working with. So basically the first phase that we're trying to do in 7 locations in the state of Florida is to fine-tuning the flow, fine-tuning all the details that is needed. But in the meantime, all the marketing activities will start on their side at locations and digital marketing to invite people to, you know, to start downloading the Hydreight app or booking all their services through the web-based system of the Hydreight. So at the end of the day, all the customers will end up being a Hydreight customer when they start offering that. So that's the plan. And on the growth, as Shane mentioned, we're gonna be focused in 1 state, then we're gonna go to 10, and then we're gonna cover you know, the 49 states. This current chain is 40. They have 49 states, but through the network of the pharmacies that Ola works with and they have in their network, they cover all the 50 states.
Awesome. Thanks, Fahid. I guess following that question, you know, one of our Hydreight strategic priorities is to continue adding products to our already robust product offering. In terms of the partnership with Ola, what services will they offer from the portfolio? Which are they most interested in, and which ones do you think will be the most profitable moving forward?
The full suite of services. Obviously, this is a bricks and mortar collaboration, so there is more ability to offer in-house services as opposed to some restrictions that are on mobile, but not many. So IV therapy, NAD+, all of the GLP-1s and peptides, obviously lab testing that will result in a follow-up service. So all of the above. What they're most interested in starting off with is the IV therapy. Obviously, the GLP-1 craze is well known, and that's going to be very popular for them. But the IV therapy is something that they have identified as a massive interest level from their customer base, and they're very excited to get going with that therapy as well as the GLP-1s.
And then Shane, that's a great segue. Based on what you're seeing in the marketplace with IV therapy, talk about kind of Florida as a pilot project. And do they already have strong demand for the IV service business environment?
Absolutely. Florida is a hotspot. We see it already on our Hydreight platform in the mobile side of things, but 2 of the 7 locations, one is Tampa, one is Palm Beach, Florida, very affluent areas, a lot of demand, a lot of IV therapy culture there, and they have absolutely identified that their customers, they're essentially sending them somewhere else. So they're trying to turn their facilities into a front of house wellness center. That's the vision, and utilize the Hydreight network from full end to end to do that.
Great. And can you explain a little bit more, just touch a little bit more on the brick and mortar relationship with the Hydreight nurses? So the services will be provided at these brick and mortar locations, but booked through the Hydreight app.
Correct. So Hydreight has the ability to have at facility bookings on the app. We can attach nurses specifically to a facility only, so that they are servicing that facility without the bricks and mortar actually incurring the cost of having service providers on demand all day, even if they're not busy. When you marry that with the oversight that's needed to offer these services compliantly, i.e. a physician needs to be on demand for telemedicine, there needs to be a medical director overseeing all of that, the physician and the service provider, and it all needs to be done on a compliant technology. That's what makes this exciting for Ola, and obviously it's utilizing our network that we have built. So it is an incredible entry point. Turnkey is a word that's a lot overused. I probably overuse it myself a lot, but this truly is a plug and play for these facilities to get into this space by just utilizing Hydreight.
Awesome. No, that's some great color. One other question about kind of, I guess, the Ola network. Do any of these pharmacy or this pharmacy network include the CVS or Walgreens network? Or are these all independent pharmacies?
So again, we'll talk about the pharmacies again shortly, and we're gonna have an announcement. Just to answer that, no, it's not, but they have chains that they have over 1,500 locations, or 1,200 locations on their network. So, but again, from the details of the pharmacy network that they have, we're relying on the numbers that they have provided. They provided names and all that, and we had conversations with them. From announcing the names of which of the chains is gonna go first, we're gonna make that announcement. And just one point to that, they mostly focus with the group franchise, the franchises or multi-locations. When this exercise is done and we set up the infrastructure for this, then Hydreight can become the marketplace for any independent pharmacy to be added to our network. And they can use our infrastructure, they can use our nurses to start providing that. For those of you who listen to us from Canada, if you go to some of our pharmacies such as Shoppers Drug Mart or even London Drug and all that, you see that they are trying to dedicate a space within their pharmacies to start offering different services such as vaccinations, such as different things. So that's the same thought process with the wider offering catalog that being done by a nurse and can be at any given time. It can be pre-booked or again, depending on availability of the nurses can be done at a time. And again, our vision is we also is gonna become we're aiming to become the marketplace for any single to 5 location pharmacies that they won't be able to do these big initiatives, just be added to our network and be added to our locations and services being offered by our nurses.
Awesome. Thanks, Vahid. And talking more about kind of the nurse acquisition and customer acquisition, how do you see this partnership being used in terms of customer, client, patient acquisition? And how do we keep those sticky?
So regarding the customers, it's extremely straightforward. We are providing the network, the platform to provide the services at their facility. In return, they are going to be marketing these services, to their current customer base and outside of that from a corporate level. That is going to turn into downloads on the Hydreight app. Obviously, what's very attractive to them is our web-based solution as well, so that can be booked directly with them outside of the download aspect. So as we expand to 2, 3, 5, 1,000 locations across the country with this initiative, it's going to lead to significant downloads. Again, obviously, I can't talk about numbers, but it's going to be significant downloads as this gets successful. On the nurses side of things, we have already identified as we expand, if there is not current Hydreight business partners in around a location, Ola will utilize their nursing network, which they have through other relationships, to bring those nurses to Hydreight to then service the facilities. So everyone is always a Hydreight nurse. That's not just a business relationship with Ola. That is a compliance thing. So obviously, what we're providing is compliance at the end of the day. So as they provide nurses for a location that we do not have a current business partner, they will be onboarded as a Hydreight nurse. And then obviously, as they market that facility to their clients, we will increase our user downloads in those areas. So it's win-win on both sides, but it's also a win for Ola. Let's not forget this. Without the Hydreight network and what we have built, this would be almost impossible to do nationwide.
Before the next question, just I see a few questions coming regarding how this is going to impact the different revenue streams that we have. So I'm just going to talk about that in a very high level. So that is going to be supportive to all the 3 revenue streams that we have. We're going to have our margins from the pharmaceutical products. We're going to charge our 10% on any services that being booked, and the nurses is continue paying a subscription. We may have a new subscription for the nurses that they will bring on board with us, and they only going to offer at their locations. But as soon as they want to start offering at home, then they have to go on a full subscription. So this initiative is not going to change anything regarding our revenue streams, and it's very supportive of that. So we keep our margin on all 3 revenue streams on this one. So I saw a few questions came regarding the revenue. I just wanted to lay it out. Now, in the future announcement that on the initiatives that we're doing on the pharmaceutical product line that Shane had a high level touch on, that is going to also add to our margin in the pharmaceutical sales. But we'll talk about that later on when we finalize everything and we get that part of the partnership going.
Fantastic. No, I think that's important. Thanks, Vahid. I think we've probably got time for 1 or 2 more, but how will you acquire new pharmacy locations? Do you have a salesperson targeting these businesses, or how will Ola decide which locations to add to the platform after phase 1 going into phase 2?
So there are 2 different level in that question. The first level, we're focusing on partnership with Ola to bring the pharmacies that they're ready to offer these services based on the stats that they already have on the clients that they're asking for these services. As I said, this initiative is not an initiative that they decided overnight. There was a lot of research on their side. There was many conversations and work on our side to get it to this point. So for this partnership, Ola has already identified the locations for the next 60 to 90 days that they're gonna go live. Based on the fact that everything goes smoothly on the operation side and tuning up all the details as soon as we go live. After this model is created, then Hydreight is going to have its own sales and marketing team to go after the pharmacies and invite them to this model, very similar to the nursing side. But to start with, we just want to put our focus on this partnership to master this level of the offering and this revenue stream. And then after that, we'll work on expanding our network ourselves. So that's kind of the two layers to the answers to your question.
Great, thank you. And then in terms of the locations and the rollout of the locations, how will those locations be integrated into the mobile app or the health tech platform? How will we be able to see those locations?
Yeah, so as I said, that aspect already exists. When I first came on here today, I commented about this being the expansion of an already well-defined vision. So all of that already exists. So there will be facilities on the mobile app. When you go to the app right now, you can actually select whether it's a mobile service or an at facility service. We already have facilities, quite a number of facilities on our app that also do mobile. So these will be onboarded as facilities, and essentially you'll select the facility, you'll select your location, and you'll select the services you want to do, and that's if they're going through the app. Obviously, the facilities themselves will be promoting the services at location through their email chain, through other means, for the clients to book as well. But yeah, that already exists, and we already do it. We just this is a large nationwide endeavor.
Perfect. Let me just see. You know what? I think we're going to wrap up. We've got 1 or 2 minutes left. Vahid, Shane, thank you so much for your time, and everyone for joining the call. We look forward to continuing to provide updates on the business and our growth, and we'll certainly be in touch with all of you.
Thank you, everybody.